By the end of this module, you will understand how to embed mental health principles into diverse environments, be able to influence policy, culture, and leadership within their institutions, create scalable programs for mental health promotion and crisis management, build community-wide mental health resilience using sustainable, people-driven strategies. This module addresses the practical implementation of mental health awareness and first aid principles across three crucial environments: the workplace, educational institutions, and the community at large. These environments are critical arenas where early signs of mental health challenges often manifest, and where proactive intervention, compassionate engagement, and structured support systems can make a transformative difference. You will explore a multi-layered approach that integrates policy, culture, leadership, peer support, communication strategy, crisis preparedness, and anti-stigma campaigns. This ensures a holistic transformation from reactive mental health management to a proactive and resilient mental well-being culture. This module is suitable for HR professionals, teachers, team leads, social workers, religious and community leaders, school counselors, and public health facilitators, and is designed to elevate mental health competence beyond theory into long-term, sustainable institutional practice. Principles of mentally healthy spaces. At the core of this module lies the concept that mental well-being is a shared responsibility, not the burden of the individual alone. A mentally healthy environment should normalize mental health discussions, offer flexible and supportive structures, ensure timely access to help without discrimination, encourage continuous training and development in mental health literacy. Building such an environment begins with policy, leadership buy-in, community engagement, and culturally sensitive programming. Workplace mental health integration. The workplace can be a source of stress, anxiety, burnout, or a hub for resilience and growth, depending on how it is managed. Workplace mental health programs should address A. Organizational policies, flexible hours, sick leaves for mental health, reasonable accommodations, e.g. reduced workload post-trauma, clear anti-harassment and anti-bullying policies, confidential employee assistance programs, EAPS. B. Manager and supervisor training, recognizing signs of burnout or depression, how to refer without stigmatizing, building a psychologically safe team culture. C. Mental health champions and peer networks, appointing trained peer responders, anonymous suggestion or support channels. D. Post-crisis support, reintegration support after mental health leave, trauma-informed debriefing protocols after incidents, e.g. accidents, layoffs, conflict. Mental health in schools and academic environments. Mental health literacy and support in schools are critical to early intervention and lifelong resilience. Schools should A. Train all staff, teachers, administrative staff, security personnel. Everyone needs baseline training. B. Build a safe and inclusive culture. Anti-bullying campaigns, clear protocols for emotional distress, sensitivity to identity-related issues, e.g. LGBTQ+, neurodivergence. C. Student peer mentoring, mental health ambassadors, anonymous reporting tools. D. Parental engagement, educating families to reinforce support at home, workshops on teenage mental health, suicide signs, and anxiety management. D. Crisis management plans, suicide risk assessment tools, school-wide trauma responses, counseling availability after community tragedies. Community mental health promotion. At the community level, we must reduce stigma, increase access, and create inclusive support hubs. A. Faith-based and cultural leaders. Engage them as mental health allies, not obstacles. Provide training on mental health literacy and safe referrals. B. Crisis intervention units, mobile mental health teams, community psychiatric nurses or responders. C. Mental health and public health campaigns include mental health and vaccination drives, maternal health, substance abuse programs, etc. D. Open forums and wellness events, mental health fairs, art therapy sessions, storytelling events, community cinema nights with mental health themes. E. Digital mental health resources, local WhatsApp groups, SMS support lines, virtual peer groups. Building sustainable systems. Long-term change requires embedded systems, annual audits, and workplace risk assessments. Inclusion of mental health, KP is, e.g., staff retention, absenteeism, regular feedback loops, surveys, town halls, external partnerships with licensed mental health professionals or NGOs.